All right, we'll go ahead and get started. Good morning, Alpha Beta Eta chapter. Thank you all for being here this morning. My name is Jessica Collinsworth, and I'm the Vice President of our Sigma chapter. Today, one of our valued chapter members will be sharing their MSN capstone project with us. Before we begin, be sure to please mute your mics and save any questions until the end of the presentation. Our presenter today is Alona Roldan. She has been a nurse for over 20 years doing telemetry, ICU, emergency room, and quality management at various hospitals. She has also worked in quality management and program management for medical insurance companies. Currently, Alona works as a patient safety officer at her local hospital, Medical Center Hospital, doing leapfrog, mortality, patient safety, event reviews, and data analytics. She recently completed the MSN F&P program at United States University and hopes to continue on her educational journey to complete her doctoral degree. Today, she will be presenting her MSN capstone project on the misuse of the emergency room as a primary care by adult patients. All right, Alona, you can take over.
Thank you, Dr. Collinsworth, and thank you so much for giving me the opportunity to present my capstone on the misuse of the emergency room as primary care by adult patients. Now, this slide talks about the objectives that I'll be talking in here on my presentation, including the overview of the misuse of the emergency room, a little bit about the poster, background significance, review of the literature, theoretical model and framework, interventions, method and designs, family and patient education, expected results, anticipated conclusions, and the potential implication to practice. Now, let's talk about the overview for this presentation. There are about 619 million emergency department visits nationwide, and this is also rapidly increasing over time. The increase created challenges for the emergency clinicians as well as the healthcare system as a whole, increasing the burden which fallen disproportionately on the emergency room and their clinicians or providers, according to Becker, Legg, and Hudgens in 2022. Now, the study that was conducted by United Health Group in 2019 showed that the emergency room cost of care is 12 times higher than if it happened in the primary care offices, or 10 times higher if it occurred in the urgent care facilities. Now, let's talk about a little bit about the poster. The significance and background for this presentation: there are about 60% of adult patients with at least one chronic condition who visits the emergency room, and the highest among patients with 3 or more chronic condition, ages 45 to 64 years old, according to Santo et al. In 2022. Now, this causes an overcrowding in the emergency room department, which is global concern right now, that negatively impacting the entire hospital, leading to the serious consequences, including the affecting the resources for the hospital and the quality of care and services that's being provided to the patient. As for the method and design, the purpose of this project is to determine why there is a misuse of the emergency room, now focusing on the local hospital, which is the Medical Center Hospital. Now, this is also delving into the issues such as the reason why patients are presenting to the emergency room, as well as identifying any incentive programs or any initiative programs to help alleviate the growing number of the misuse in the emergency room. Again, for the purpose and aim of the project is focusing on the Medical Center Hospital misuse of the emergency room. As for the expected results and outcomes, this is to decrease the misuse of the emergency room as primary care by adult patient at the Medical Center Hospital, also increasing the access to care with providers in the community, as well as not expanding the knowledge of the patients. As for the scope and evidence, I will allude to that more on the following slides as I delve into the interview as well as the data analytics for the Medical Center Hospital. As for the anticipated conclusion, once again, is to decrease the emergency room at the medical center and increasing the medical providers in the community, and lastly, the local and federal government attention to the affordable health care. And I'll delve into the potential implication more so on the following slides. Now, let's talk about the background and significance. The emergency room department utilization by older adult has steadily increased over the last 3 decades, according to Cobb et al. In 2023. This also resulted in the increase of the Medicare or CMS contribution to manage the older population. The 2014 to 2017 study conducted by CMS showed that there's about 20% of all emergency room visits in the United States that are older adult patients, and 1 in 4 resulted in the hospital admission. Now, this is in the state of Texas, where I'm currently residing. In 2020, there were approximately 880,000 potentially preventable emergency room visits, according to the Texas Medicaid and CHIP programs, that resulted in the expenditure in the upwards of 378 million. If these visits are to occur in the primary care setting or could have been prevented, it is assumed that expenditure could be lessened or actually avoided altogether. This is according to the biannual report on initiatives to reduce the avoidable emergency room utilization and improvement outcome in Medicaid as required by the Senate Bill 1136. Now, focusing on the medical centers for the background and significance. The Medical Center Hospital is a 402-bed Level 3 trauma medical center located in Odessa, Texas. It is located in the heart of the Permian Basin, a city rich in oil and natural gas that boasts a booming economy, which comprises of over 112,000 population. At the same time, it attracts transient workers from all over due to the availability of various works. Now, the hospital or the county itself is surrounded by rural areas where the hospital services has a huge catchment area that comprises of 17 counties. This is stretching from El Paso, Texas, to some parts of New Mexico, as well as the US-Mexico border. With this, the Medical Center Hospital received patients locally, as well as from these outlying areas and outskirts of El Paso, New Mexico, and also who are utilizing the emergency room services as their primary care physician due to the limited resources for their areas. Now, the MCH utilizes a traditional single flow model, prioritizing the care of their patient with the use of the Emergency Severity Index or ESI acuity level, which means that the higher acuity patients are seen first or given the priority as opposed to the lower acuity patients. With that, the emergency room underwent a major restructuring to improve the throughput process by implementing a split flow fast track model. In this process, the hospital has a 3 pods, pod A, B, and C, which now they've allocated pod A to C patients who are triaged as ESI level 1. Pod B is allocated for ESI level 3, and pod C is allocated to levels 3 and 4 patients respectively. With this, it allows for the patients on all of those pods to be seen accordingly in a timely manner. Now, let's talk about the literature review. I've actually read 20 applicable articles, but only included 10 articles in this presentation, in this capstone, including a community health assessment needs for the Medical Center Hospital that was conducted by Community Hospital Consulting in 2022. Now, all of these articles highlight and address the questions surrounding the contributing factors to the misuse of the emergency room and what can be done to alleviate the problem. Of this, there are commonalities, including the contributing factors such as access to care, lack of primary care providers, as well as socioeconomic issues. Now, the other articles, according to McIntyre et al. In 2023, their study showed 7 themes such as lack of knowledge of healthcare issues, knowledge and awareness of alternative services, dissatisfaction with primary care providers, satisfaction with the emergency room services, the emergency room accessibility and convenience, and some who were actually referred to the emergency room by their primary care providers. This also showed a disproportionate amount of non-urgent patients use the emergency room for emergency care services. Now, let's delve into the common contributing factors in accordance to this literature. Now, the first two were the access to care and lack of primary care provider. This is actually multifactorial or two-factorial, which is the first one is the access to care that is due to the limited number of providers in the community. A review of the article by Weatherby Healthcare indicated that there have been difficulties in contributing recruiting physicians to rural areas or to the areas where they have healthcare facilities that are servicing the rural areas or counties, with 65% of rural areas in the United States experiencing shortage in the physicians in 2023. The next factor is the access to care that is defined as the hours of operations, their location, and their weekend availability. Now, many of the primary care offices are open during the week, Monday through Friday, from 8 to 5, making it difficult for the patient who works during the week to make an appointment outside of their working hours. Now, the limited hours are also due to the operations stemming from the COVID-19 pandemic and have remained constantly throughout the year. According to CMS, the lack of relationship with the primary care physician by their patients or their care team contributes to the reason why the patients are choosing the emergency room as well. Now, let's discuss the common contributing factor, as it also involves focusing on the medical center. This is so true for the city of Odessa, where the hospital is located. Due to the pandemic, all of the providers are actually limited to their Monday to Friday from 8 to 5. Likewise, their urgent care also is open Monday through Sundays, however, with limited hours ranging from 8 to 5 or 8 to 8 p.m., which leaves the emergency room the only viable option for majority of the patient to seek for the care and services outside of these operating hours. Now, talking about the socioeconomic concerns, according to Nauri et al. In 2020, inappropriate emergency room use is due to the individual's socioeconomic concerns, such as not having their healthcare insurance coverage, low income, where they live, or the geographic location, making it difficult for them to find providers. According to Rodriguez in 2024, the increase in rate of poverty, disability, as well as the chronic diseases in rural areas, compounded by the fewer number of doctors or providers per capita, and some closure of the hospital that affects the community health. The difference in the availability of healthcare resources comprises the accessibility, quality, and affordability and access of care in rural areas. Now, in correlating that with the medical center hospital, according to the community health needs assessment and implementation plan for the 2022 for MCH, this was conducted by Community Health Consulting. They showed that although the city as a whole is a thriving city, the county has seen a rapid growth as well as the significant population with transient workers that affected the current was due to the current oil boom as that affected the community as a whole. And part of the capstone also, I did my interview to better understand the contributing factors and the causes to the misuse of the emergency room. Additionally, I also explored the primary care physician's opinion as well as their potential resolutions that they've actually suggested or have alluded to. Now, the interviews were conducted with the MCH emergency room assistant nurse, chief nursing officer and a couple of his staff, as well as a primary care physician who practices locally in the community and a nurse practitioner who practices locally as well. I narrowed down my questions to 3 questions. The first one is, Why are the adult patients with no urgent, emergent, or life or limb-threatening emergencies presenting to the emergency room? The next one is, what has the hospital done to resolve and alleviate this concern? And lastly, what can be done further to help resolve this concern? The feedback from the interview were from their perspective and from their own lens and experiences. But at the same time, I took that as a qualitative data that I've collected to see and analyze to bring the conclusion, and also any contributing factors from it for the growing misuse of the emergency room. Now, my interview with the hospital's ACNO, he indicated that the contributing factor is due to the lack of the primary care physician in the community, also the growing number of transient workers due to the oil field, who are, for the most part, some of them were uninsured, and also they brought with them their families who are not yet or unable to establish the primary care provider locally as well. Now, at the same time, he also included that the ED wait time was a contributing factor, as well as the holiday and weekend closure for majority of, or if not a lot of the local clinics and providers, as well as the lack of aftercare services. And at the same time, he also included that the urgent care is capped, meaning they can only service the community at a certain given amount of time. Now, according to his staff, I interviewed a couple of the ED nurses. They included contributing factors such as delayed in appointment with primary care physician, or the patient refusal to see or seek care at the urgent care due to the out-of-pocket payment upfront, and also the quick turnaround time in the emergency room. Now, according to the primary care physician, she indicated the contributing factor was due to the growing number of patients with chronic and severe medical condition that is partly due to the predisposition. And lastly, according to the family nurse practitioner, he indicated that the contributing factor is due to the patient's non-adherence and non-compliance to the treatment, lack of follow-up visits, refusal to pay for the co-payment of or out-of-pocket expenses up front, lack of insurance coverage, as well as the clinic's lack of after-hours or weekend coverage. Now, as for the theoretical model and framework, I've included this graph that showed the contributing factor, the impact, and also the outcome. Now, let's talk about the intervention. There are various interventions that have been successful in reducing the misuse of the emergency room, including education, connecting the patient with primary care providers or PCP, as well as the availability of urgent care centers and the telehealth. According to Fernandez et al., in 2023, improving primary care provider access is essential to measure the reduction in the misuse or increase of the government funding for the clinics. Furthermore, according to O'Kathan et al. 2020, multiple interventions may be needed to reduce the clinically unnecessary use of the urgent care, as well as the emergency room. That includes healthcare changes, access to care, as well as finding the root cause with data analytics. Now, according to Rodriguez J. 2024, the USDA findings strongly suggest a policy focusing on rural areas or rural health, finding out the disparity with the greater needs and attention from the state and national leaders, as well as taking the community approach, not just how we can keep the hospital open, but rather how can we keep the community alive. Now, this slide talks about the methods and design. For this project, I utilized a mixed method that showed bringing together the combination of data that I will allude to on the following slide. Now, this also actually answered my inquiry in the beginning as to the reason for the adult presenting to the emergency room, resulting in the misuse of the emergency room, as well as what are the community, local, and state programs that are available to help mitigate this issue. I also explored the contributing factor such as with the use of the ESI or the severity index level from level 1 through 5. Now, for this project and with regards to the medical center hospital, the ESI level 4 and 5 were actually used for the analysis. Review of their 2023 emergency room data showed that there was a 53,375 adult patient ages 18 years and older who were seen in the emergency room. Of this, there were 6,044 or 11% that were categorized as ESI 4 and 8,079 that were, or 5% or 15%, sorry, that were categorized as ESI 5, which brings a total of 14,136 or 26% of the population were ESI level 4 and 5 respectively. A retrospective of the cohort study for a total number of the ESI 4 and 5 were further segmented and also to help identify further contributing factor to the misuse of their population going to the emergency room. I also looked at the ESI level 3, which showed 21,871 or 81% of the patients were discharged home, eloped, or left without being seen or triaged. Now, let's talk about the patient education. This includes follow-up and adherence to medication management, as well as according to Texas Health and Human Services, they've indicated that education in chronic diseases, self-management for chronic care management at home, teaching patients to navigate the healthcare system, as well as helping the patient navigate their financial aspects when it comes to receiving healthcare, as well as promoting the availability of the clinics locally. As for the expected results, it's actually threefold. First is the data analytics, which is a thematical synthesis by conducting a systematic review of qualitative studies to allow for general concept and root causes to be identified. For the qualitative data, this is for the data to show the use of the ESI levels, identifying ESI level 3, 4, and 5, as well as the qualitative data to help drive the opportunity to decrease the misuse of the emergency room. And lastly, with the quantitative data, utilizing the interview to help drive, again, the improvement. Now, with this, I just want to mention there are limitations to this project, which is primarily associated with the interview portion. With the participants' distinct roles, their responses were only geared towards their own perspectives of what they have seen and what they have experienced within their realm of their own practices, which influenced the answer that they have provided. For example, when I interviewed the primary care physician, her response was geared towards the patient's predisposition, but she did not really elaborate on the details. Whereas the family nurse practitioner, he focused on the lack of the aftercare hours and weekend coverage by the primary care provider offices. Another limitation is that from the 3 participants from the medical center hospital, and also 2 of them were on the private practice who are practicing in the community, which means that their responses again, were solely focused on their practices only, but may or may have not necessarily crossed each other also. Another limitation is that all of the participants have very few suggestions on the mitigating misuse of the emergency room. At the same time, the emergency room's implementation only pertains to the throughput process, which is related to the CMS measure of left without being seen, that does not necessarily address the misuse of their emergency room. Also, there is no current implementation by the MCH focusing on the misuse of their emergency room. And lastly, there is no discussion about starting an after hour with the two practitioners, the primary care physician and the nurse practitioner in their offices, because they cannot really, they don't have a say on it, or they are not in the position to determine the changes. Now, the fact of the matter is the emergency room is open 24/7, and legally they cannot turn away the patients. This issue is not really going away, but mainly the focusing on driving to improve on decreasing perhaps the ER misuse instead of eliminating them. Now, for the anticipated conclusion, according to O'Kathan et al., there are multiple interventions that may be needed to reduce the clinically unnecessary use of the emergency and urgent care, including healthcare changes, access to care, and finding root causes with the data analytics. Again, the appropriate use of the emergency room needs to be looked at as well. Now, as for the potential practice implication, there are actually multiple implications. The first one is a positive implication to the practice, focusing on the evidence-based practice for the medical center hospital that services rural areas in the community outstretched to New Mexico and the US-Mexico border. Number two is the meta-analysis on the misuse of the emergency room as primary care by adult patients for hospitals that are servicing rural areas, also including the sustainability of their providers, as well as the succession planning for the current primary care providers. Number three is the state and federal funding for hospitals who are servicing rural areas that allow them to hire qualified providers to mend the widening gap in care. Number four is, or lastly, as a would-be family nurse practitioner, as for my practice, I would be educating my patients on their care management, as well as when to seek care in the emergency room, or when to seek emergency care services, and as well as involving them and their caregivers with their disease management so they can manage their care at home. And the last two slides are the references that I've used for this capstone presentation. Thank you so much.
Thank you so much, Alona. Well, I first just wanted to say congratulations on your amazing project. It's such an important topic. I think this is a problem pretty much everywhere. And it seems like you've really became an expert on the topic. My question is, I know that you had said that you want to go on and do your doctorate. Or do you think you're going to continue and make this the topic of your doctoral project, or have you thought that far? Or
I've actually did. This project was actually, I started this with my undergraduate at Aspen University, and my professor at that time said that I want you to get your master's degree and continue on with this. So I will be continuing that onto the doctoral also.
Very exciting. All right. Does anyone have any questions or comments?
Yes. Thank you.
Just great presentation, and congratulations. And I wish you all
Thank
the best in your doctoral program.
Thank you, Dr. O.
Yes, it was very interesting. And unfortunately, with this, I think you nailed a lot of it on the head. It's multifactorial, and I don't know how easily change will come, and even in the community with inappropriate overuse of the ER. As an ER provider, it's a tough, and then I'm in a small community. So good luck and best of luck to you. It was a wonderful project and topic. Thank you.
Thank you.
I'm not sure why
Now, if I can
Dr.
add what I did
Stahovich,
also,
oh, sorry, Dr. Stahovich put something in the chat, but I was going to say it as well, that your presentation skills is excellent. I think that's something. And so somebody else put it in the chat, and I think I need to say it out loud because I was going to say, but it's, you have a very good presentation skill. So keep it up. It's going to come in handy for your DNP. So that gives you an edge over a lot of people. So keep that up. Yeah.
thank you.
Yep, I totally agree. All right, well, thank you so much for presenting to us. It was a pleasure. You guys all have the great rest of your day.
Thank
Thanks.
you. Thank you. Bye-bye.